Today, I'll take you through a push day, but I also wanted to talk about a question I get asked a lot: why I chose PM&R. And I don't think I've ever given a fleshed out answer to this. I think to give a true answer, I'll have to take you back to my childhood. Since I could remember, all the things that I enjoyed involved movement, from playing soccer to dancing. I also remember being so excited to turn 13 so I could finally join my father's gym. From there, I continued weightlifting throughout high school and college to this very day. In med school, however, I developed interest in things like calisthenics and yoga. At its core, I became fascinated with mobility, or the ability of our bodies to move throughout the world. Around the same time, I was a third year in med school going about my clinical rotations, trying to figure out which area of medicine I wanted to go into. I had some interest in internal medicine and surgery, but I didn't feel particularly called in those directions. In all those areas, I remember speaking to patients, getting to know them personally, and I found that although they were concerned with getting through their hospitalizations, what they really wanted was to get healthy so they could be able to go back home, return to golfing, running around with their grandchildren, walking through their community, all things that involve movement. And although many got through their hospitalizations, they were extremely deconditioned after spending weeks in a bed ill. I was conflicted and wondered who was in charge of getting them back to their baseline. Here was reaffirmed that mobility is directly proportional to your quality of life, and much of what I was seeing in the hospital didn't focus on this at all. Towards the end of my third year, I learned about PM&R, an extremely broad field that's not limited by organ system, gender, or age. And PM&R role is to optimize mobility for anyone with any condition, disease, or injury that limits their mobility. Whether it's a traumatic brain injury, a chronic pain condition, sports injury, burn rehab, neuromuscular condition like cerebral palsy or multiple sclerosis, the job is centered around making sure our patients can move as best as possible and interact with the world around them, something that I truly find valuable. And all of this is just what set me on my current path. I definitely have to expand on this further in a future post, but I'm just so glad I found a field that I truly resonate with.